Let's move on to the second antifibrotic, which is nintedanib. And this particular paper was in the same issue of the New England Journal of Medicine as was the results of the ASCEND study. What was shown with nintedanib was very similar to what I showed already with pirfenidone, that it slowed the rate of loss of lung function, specifically the FVC, over the course of 52 weeks. And there was the same signal seen from the two studies that were done for nintedanib, INPULSIS 1 and INPULSIS 2. And this was actually very similar to what was seen in the phase 2 study, which was known as the TOMORROW study. Also seen over here, the curves come apart actually quite early, and this attests to the early implementation of therapy. The earlier one can start patients on therapy, the earlier there can be preservation of lung function for both nintedanib as well as for pirfenidone. Another endpoint that was looked at in the INPULSIS studies was the time to first acute exacerbation, and there was a positive signal here as well. It did appear that nintedanib resulted in a delay to the time for an acute exacerbation of the disease. As with pirfenidone, there are side effects associated with nintedanib. These are mostly GI once again, most specifically diarrhea, which can affect about 2/3 of patients.